Hi, my name is Chris Centeno. I'm the Chief Medical Officer of Regenexx, and I'm a practicing physician as well. And so I'd like to talk to you as a practicing physician who sees what goes on the ground about why not having an orthopedic surgery gatekeeper is destroying your orthopedic spend. So we have prima facie evidence that appropriate orthopedic surgeries are things like fixing fractures, fusing severely unstable spines, reattaching completely torn tendons and ligaments, or replacing joints when the person can't walk. However, orthopedic surgery has moved into these other surgeries, which we now know largely are ineffective. Treating painful joints because there's a meniscus tear, fusing a spine just to treat pain, partial and non-retracted tendon and ligament injuries, and replacing joints in otherwise active and healthy people. Now, we have multiple controlled trials that have shown these sorts of surgeries do not work. And in fact, 58% of orthopedic surgery has been shown to be ineffective in clinical trials. Hence, your health plan is left paying for expensive and invasive procedures that we know aren't effective or we don't have any evidence of efficacy. So if we look at an example here, we've got lumbar fusion would be clearly needed in a burst fracture or a severe spinalolisthesis or severe instability causing a spinal cord injury. But there's no clear benefit at all that it helps back pain, degenerative disc disease, mild spinalolisthesis, or mild instability, but we actually have many more of those surgeries that you're paying for than the latter. So how do you get from where you are to where you need to be? First, you need to understand the incentives for why we have seen an explosion in orthopedic surgery costs over the past 2 decades. Orthopedic surgery is the biggest profit center in a hospital. Each orthopedic surgeon brings in $2.7 million compared to $1.4 million for a family doctor. And most hospitals have figured out that to keep those surgeons loyal, they can joint venture on ambulatory surgery centers, basically double incenting the surgeon. He gets a surgical fee as well as he takes a piece of the OR fee. Hence, as the New York Times coined the phrase, this is why useless surgeries, many of those are orthopedic surgeries, remain popular. And because of these perverse incentives, surgeons and hospitals can never be part of a cost savings plan to reduce your orthopedic spend. Well, another option would be putting family doctors in charge of being a surgical gatekeeper. There's just one problem. Family doctors increasingly work for the same hospital systems we're talking about. Right now, or at least as of 2016, 68% of family doctors had no ownership stake in the practice where they work. Basically, family doctors are increasingly employed by hospital systems. Hence, family doctors are now employed by the very hospitals that would lose their shirt if orthopedic surgical rates declined. So who can reduce useless orthopedic surgery rates? Not an orthopedic surgeon. They can't be employed by a hospital. And they've got to offer something that actually works, that isn't surgery, that can be delivered much more cost effectively. Well, meet the Regenexx Gatekeeper. After an injury occurs, the patient goes to see a Regenexx Gatekeeper, and if he or she can't handle it, it goes to orthopedic surgery. But using that method, 70% of current elective orthopedic surgery can be eliminated. So you owe it to yourself to find out more about how Regenexx can save you money on your elective orthopedic surgery spend by putting in that gatekeeper who is not incented to rip you off, but instead incented to reduce orthopedic surgery rates. Thanks so much and have a great day.